Well, when I had my prostatectomy, I sat down and told the surgeon, I said, in 5 years, you're going to put me on testosterone replacement. Well, here I am now 6 years out because I was aware. I'm aware that I've always been a fan of hormone replacement therapy for women, and why shouldn't men be replaced, at least to the extent that we're not overshooting or causing adverse events?
Well, and the urologists that I train,
Yeah.
and I train them across the country, they would say once you've had your prostatectomy, once your prostate cancer is treated and your PSA is negligible, we treat. We don't wait 5 years. We don't wait 1 year.
But mine's not negible. Mine's it's negible and creeping.
Trending
yeah,
up. So when you get that treated, then I would absolutely recommend.
That's what I'm I'm listening to my friend here. BioTE is where I'm going to go. I don't know if my UCLA team will sit still for that, but maybe you'll have trained them in the meantime. Some of this stuff. So there's so much benefit for the male. So let's stay with the male for a second. Obviously, muscle mass, obviously libido, vitality, cognition, cardiovascular health, all this stuff. Now, how far out do we have the studies to show the continued improvement? That's the part I've always wondered about it. We kind of know it's good. It's very much like my CBD stuff, which is we kind of know this stuff working. The weeds aren't fully worked out yet. Am I right about that?
Well, it depends. So in terms of pellet therapy on women, we've got 80 years of data.
No, I got
on
that.
men, for us, we've been treating men for more than 10 years now, and we have data, whether it's complication data, we have that. What we see is there's a reduction in cardiovascular disease that's sustainable. What we see is
cerebrovascular.
So in terms of side effects, we don't have any increased risk in stroke. We don't have any increased risk in DVTs on pellet therapy. And that's been true of multiple studies.
So that belies the question, how do you determine a target level for a given male? Because our normal ranges are all over the place.
Exactly. So much like it is in females, we found at BioTE, we sort of have a sweet spot on testosterone levels. So most people...
Serum testosterone?
Serum testosterone.
Free testosterone?
And free.
What's the number?
So for men, it's going to be 900 to 1,100 on the total.
That high?
Yes.
Because that's above 800 sort of surprises me.
Here's why, though.
Right.
As you get older, not that you're old,
I'm
as you get older, your sex hormone binding globulin, that's that protein that binds up testosterone, goes up naturally. No matter what you do, it still goes up. As that goes up, it binds up your testosterone. As you mentioned, the free testosterone is the more important. We want the free testosterone above the median.
Which is?
Depends on the lab. That one moves around. So for it's like CPL labs, it's 15.5. For Quest labs, it's 95.5. So you have to know your lab, which is fine.
Yeah.
But the more important thing is you get it above the median. So
15 sounds high to me too.
No.
15 is a free testosterone.
We actually take it higher than that. And we do that safely because for men, you have a big, very wide standard deviation before you even have to worry about side effects.
So I'm going to ask you a maybe provocative question, maybe a fair question. Do you take it?
Yes.
Okay. And I'm sure you've noticed differences.
Yes.
Yeah.
And so you have to think about it.
So
for
jealous.
guys,
it's so jealous.
It's so easy, and your side effects that I know you want to talk about are minimal on the male side.
Yeah.
So you're going to have
Has
a
your
little.
balding gotten worse?
No. I had that before. Thanks for noticing
that. But that's what people worry about.
Is it gray or is it brown today?
It's a little brownish.
Okay, good.
Mine's more grayer. I assure you of that.
C.
In terms of so are we we've sort of slogged through the male, right? We're sort of said most we need to say about the males or more.
It's all up to you.
Well, no, please, there are more you wish to say about the males.
Well, I think
I've had my personal questions answered. My questions for my patients are sort of clear in my head. What else do you want us to know?
Well, the male side, again, is very safe. So you don't have to. A lot of people with hormone replacement therapy, they get caught up in the risk. And what I do is travel around.
But that's us, right? That's we're supposed to. That's risk-benefit ratio in always every therapeutic decision, right?
Exactly. But we got to decide what are those risks.
Yeah, because that's why I asked you about the time frame, right? I want to know 10 years. I want to know 20 years what the risk is so I can make my decision.
Right. So if you know, let's just take them kind of in order of your brain function. People always think about Alzheimer's disease as something that occurs in old people. The reality is beta amyloid, that superglue substance, gets laid down in the brain in your 30s. Mm-hmm. Cognitive decline starts in your 30s. Hey, guess what else starts in your 30s? Testosterone starts declining. Yeah. So for us, timing is everything. Why do you want to wait till you're 70 to start hormones when your brain's been declining for 40 years? It's the same with the heart. If plaque formation starts in the heart in single digits when you were 6 or 10, you're an internist, so you know more than me about that. Why do you want to wait till you're 50 to start treating the inflammation, start treating the plaque? So that's another thing. Same with your insulin resistance. Why not get there earlier to the party?
That may be
20% of osteoporosis is in males.
Yeah.
So why not protect your bones?
That once we work out that insulin story, it may be the bigger story.
Right.
Once you know that,
agree.
but we don't really fully get it yet. All right. So I'm sort of persuaded that's a interesting thing, an important thing. Again, we're always trying to make risk-benefit ratio analysis in our field, and do no harm is something that's drilled into my head.